Hi, I'm Dr. Michelle May, the author of the Eat What You Love, Love What You Eat book series and founder of Am I Hungry mindful eating programs and training. Am I Hungry offers non-diet, weight-neutral, mindfulness-based programs that empower individuals to take charge of their decisions about eating, physical activity, health, and self-care. During this short video, I'd like to explain what we mean by non-diet, weight-neutral, and mindfulness-based. First, a non-diet approach doesn't encourage restriction or deprivation. Instead, a non-diet approach encourages a more natural, instinctive way of eating founded on becoming attuned to internal cues. You may also be familiar with intuitive eating, a term originated by Evelyn Tribole and Elise Resch in their groundbreaking book by the same name. A non-diet approach guides individuals toward a flexible, sustainable, and satisfying relationship with food by relearning how to make decisions based on their own body wisdom in any situation. This is important because there are many examples of programs that label themselves as non-diet, yet ultimately promote restrictive eating. Examples of restrictive eating include recommending that you consume a certain number of calories, grams, or points, eliminating or restricting certain foods, ingredients, or macronutrients, most often carbs or fats, avoiding or limiting tempting foods, eating on a schedule, not eating after a certain time of day, or fasting for a specified period of time, earning food or the right to eat by exercising or using exercise to pay penance for eating. In short, a non-diet approach promotes awareness of internal cues and application of internalized decision-making. Therefore, arbitrary rules about food or eating are not compatible with a non-diet approach. Instead, a non-diet approach encourages a more natural, instinctive way of eating. That means relearning how to manage food intake by becoming attuned to internal cues such as hunger and satiety, rather than external rules that may be confusing and difficult to follow indefinitely. The non-diet approach shifts away from the concept of good and bad foods and supports the idea that for most people, all foods can fit into a healthy lifestyle. Instead of a rigid eating plan, the non-diet approach encourages individuals to meet their nutritional and fuel needs with attention to balance, variety, and moderation while acknowledging the important role of pleasure in eating. So what's the problem with dieting? The short answer is they don't work and they're counterproductive. The innate physiological and psychological responses to food restriction make it virtually impossible to adhere to a restrictive diet for the long run. Diets require an unsustainable amount of restraint, willpower, time, and energy. Caloric restriction results in physical hunger, increased preoccupation with food, and strong cravings to eat. Dieting also activates the portion of the brain responsible for attention to and the reward properties of food, increasing the likelihood of food intake. The high resource requirements combined with a strong drive to eat ultimately results in the dieter giving up. Breaking the restraint is often followed by a strong urge to overeat and in some cases binge eat. Further, many people have developed triggers to eat when they're not hungry or to overeat once they start. Instead of learning to recognize and address their triggers, dieters may overeat the foods that are allowed on their plan. When they go off the diet, the triggers continue to drive overeating, compounded by the guilt of breaking their diet. This eat, repent, repeat cycle is damaging physiologically and emotionally. Among other things, it can result in weight cycling, disordered eating, low self-efficacy, depression, and lower self-esteem. So what do you do instead? Am I Hungry mindful eating programs and training use a non-diet approach and mindfulness-based strategies to help participants free themselves from the eat, repent, repeat cycle and develop a healthier relationship with food and their body. I'll talk more about this in a moment, but first I want to talk about another key tenet, our weight-neutral approach. A weight-neutral approach acknowledges that body weight is determined by a complex set of genetic, metabolic, and physiological, cultural, social, and behavioral determinants, many of which individuals cannot change. Instead of focusing on a weight-oriented outcome, participants in a weight-neutral program are taught to take charge of factors such as thoughts and behaviors, which ultimately lead to improved well-being regardless of weight. The fact that weight loss programs do not create lasting changes in weight or health has been proven time and time again. A recent comprehensive review published in the Journal of Obesity called the Weight Inclusive versus Weight Normative Approach to Health, concluded that no weight loss initiatives to date have generated long-term results for the majority of participants. This review summarized numerous studies on the three most documented negative effects of a weight loss focus: weight cycling, disordered eating, and weight stigma, all of which are detrimental to one's health. Weight cycling. The most common outcome of weight loss programs is not sustained weight loss, but weight cycling, the repeated gain and loss of weight often referred to as yo-yo dieting. Weight cycling has been definitively linked with adverse physical health, including loss of muscle tissue, hypertension, chronic inflammation, more weight gain over time, less physically active lifestyles, some forms of cancer, and most notably higher mortality. Weight cycling is also associated with diminished psychological well-being, such as greater emotional distress and lower self-esteem. Disordered eating. The pursuit of weight loss can lead to disordered eating behaviors. The review finds there's growing evidence that individuals who try to achieve and maintain a weight-suppressed state are at risk for binge eating disorder and bulimia nervosa. Another recent study on a mindfulness-based intuitive eating intervention extends this concern beyond diagnosed eating disorders to problematic eating behaviors such as chronic overeating and loss of control over eating, which are surprisingly prevalent in American women. Weight stigma. The focus on weight and weight loss results in weight stigma. The prizing of the thin ideal, weight loss, and healthy weight as determined by BMI sets people up for weight stigma, negative attitudes and beliefs about people who don't fit the mold. Weight stigma is associated with diminished health and well-being, including increased caloric consumption, diminished exercise, binge eating behaviors, low self-esteem, depression, and a decrease in self-rated health. Let's turn our attention now to a mindfulness-based approach. One definition of mindfulness is purposely paying attention to the present moment, cultivating awareness of both internal and external experiences, observing and accepting these experiences as non-judgmentally as possible, choosing how to respond, and making intentional decisions. When these principles are applied to our relationship with food, we call it mindful eating. Eating is a natural, healthy, and pleasurable activity for satisfying hunger. However, in our food-abundant, diet-obsessed culture, eating is often mindless, consuming, and guilt-inducing instead. Mindful eating is an ancient mindfulness practice with profound modern implications and applications for resolving this troubled love-hate relationship with food. We love the definition of mindful eating as eating with intention and attention, eating with the intention of caring for yourself, and eating with the attention necessary for noticing and enjoying your food and its effects on your body. Of course, mindful eating is much more than just eating slowly without distraction. While that's certainly an important part of it, at Am I Hungry Mindful Eating programs and training, we believe that mindful eating encompasses the entire process of eating. Staying aware of your physical and emotional cues, recognition of your non-hunger triggers for eating, learning to meet your other needs in more effective ways than eating, choosing food for both nourishment and enjoyment, eating for optimal satisfaction and satiety, and using the fuel you've consumed to live the vibrant life you crave. This broad application makes mindful eating a powerful tool for developing a healthier, happier relationship with food. So how does mindful eating help resolve eating issues? Many people who struggle with food react mindlessly to their unrecognized or unexamined triggers, thoughts, and feelings. In other words, they react, repeating past actions again and again, feeling powerless to change. Mindfulness increases your awareness of these patterns without judgment and creates space between your triggers and actions. For example, whenever you notice you feel like eating and pause to ask the question, "Am I hungry?" you're able to observe your thoughts and choose how you'll respond. Instead of reacting mindlessly, mindfulness gives you response ability. That's how mindful eating empowers you to finally break old automatic or habitual chain reactions and discover options that work better. All the Am I Hungry Mindful Eating programs are based on the mindful eating cycle, a simple model to help increase awareness of the hundreds of eating decisions you make every day. Here are the questions the Am I Hungry Mindful Eating cycle helps you answer. Why? Why do I eat? Or in other words, what's driving my eating cycle at any given time? When? When do I feel like eating? When do I think about food? When do I decide to eat? What? What do I eat? What do I choose from all the available options? How? How do I eat? Specifically, how do I get the food I've chosen into my body? How much? How much do I eat? In other words, when do I stop? And where? Where do I invest the energy I've consumed? Do I use it to practice self-care for my body, mind, heart, and spirit? Am I Hungry mindful eating programs guide you to address these questions so you can live the big, vibrant life you crave. One final note. Some people assume that a non-diet, weight-neutral, mindfulness-based approach can only apply to otherwise healthy individuals. As a physician, I feel that those with chronic medical issues stand to benefit even more from a more sustainable way of managing their eating. When dietary changes or limitations, even necessary or practical ones, feel like a diet, people are likely to struggle with the eat, repent, repeat cycle, making a condition like diabetes very difficult to stabilize. More important, when we help patients shift their focus from weight to well-being, we create an opportunity for curiosity, learning, self-compassion, and self-determination.